Warfarin and surgery. It's important. How to deal with a patient will undergo to a surgery and he's already taking warfarin. Well, here it would depend. If the surgery is elective surgery, then stop warfarin 5 days before the surgery. It's simple. But in case of emergency surgery, then give the patient fresh frozen plasma immediately and proceed directly to the surgery because it's emergency surgery. Now, what if the patient will undergo to endoscopy? Well, here it would depend. If it's just endoscopy without biopsy, I mean it's just for observation, not for intervention, then continue warfarin or even aspirin, whatever it is. There is no risk for the patient. But if there is biopsy or mucosal injury, I mean there is interventional endoscopy, then stop it because this will lead to active bleeding. It's important. Now, what if the patient is highly indicated for anticoagulant? I mean, I cannot stop warfarin for any reason because there is highly indication for that. Then the solution here is by using a bridge therapy. What I mean by bridge therapy? Bridge therapy means stopping warfarin 5 to 7 days before the operation and change the patient to heparin instead. And then stop heparin 24 hours before the operation and resume again 24 hours after the operation. Here we will use low molecular weight heparin. And for whom we will use this bridge therapy? We will use this for patient with atrial fibrillation, artificial valve replacement, and with a patient of recent thromboembolism. So these three patients will need anticoagulant. You cannot stop anticoagulant here. So what I will do is stopping the warfarin because warfarin has a long half-life and replace it with heparin because heparin has a shorter half-life. So heparin, as he has a shorter half-life, then you can stop it 24 hours before the operation, then proceed to the surgery, and after the surgery return again to warfarin 24 hours after the surgery. So here we will cover the patient with the anticoagulant during this time and there is no risk for the patient. That's all. Remember, use low molecular weight heparin in case of bridge therapy. For full course, please contact us through amcqbook@gmail.com. Thanks and goodbye.